Hi everyone, this is Sausan Ajarme, second year student in Adult Education and the Human Resources Development Program at JMU. The video the committee is about to see will represent the cultural competency training that I have facilitated on March 5th at 6 p.m. through Zoom. The participants included nursing staff from different healthcare facilities. The video doesn't include the entire session. However, the committee will see the presentation, some activities, and the case study discussion. Enjoy watching.
So welcome everyone for the delivering culturally competent nursing care course for tonight. So welcome, thank you for joining us today. So I would start with two truths and a lie, and I have three statements about myself, and you need to find the lie from these statements. Which one do you think it's the lie?
A princess from the royal family attended your graduation. First one.
Okay. Anyone else?
Oh, the first one.
Okay. Anyone else can give?
I think the lie is you like dogs, like you're not terrified of them.
Yeah, I agree.
Okay. So the lie is my wedding was canceled.
Oh man.
Oh.
It wasn't. Yeah, it was about to cancel. Okay, so I started this activity because sometimes we make some assumptions about people can be wrong. So realizing your own assumptions and beliefs is an important step to be culturally competent. So our objectives for today, at the end of this training, you should be able to define culture and cultural competency. The last one is identify the steps using Campana-Beckett model of cultural competency that can enhance cultural competency in the healthcare. I would like to start with a few questions. How long have you been in practice as a nurse?
I have been a nurse for 4.5 years. Or going to 5 years.
So what is your current patient demographic mix?
Go ahead.
Mine is mainly geriatric population, about 85–90% Caucasian.
Mm-hmm. Fatima?
Well, as you know, we see a lot of patients who are Hispanic for the most part, and also Muslim and Caucasian also, and African Americans, and adults and children and OBs.
So next question, what does the term culture mean to you? And if you can provide examples, that would be awesome.
Your beliefs, it doesn't necessarily mean what describes you culturally, your cultural background. Some people think that just because you were born in a certain country that you have to follow the culture, or you'll have the same traditions within the same group of between the same group of people. And culture is what you represent, you identify yourself as.
Thank you. So what does cultural competence mean to you?
I think a big part of it is understanding the customs, practices, beliefs of another culture, and respecting that and incorporating it into your practice, like helping serve them in a way that they understand and they agree with.
The United States population becomes more racial and ethnically diverse. It is important to consider different language, different culture traits, because that influence many things and impact many things in healthcare. How does culture impact the care that is given to the patients? What do you think? What's the impact?
Well, not everyone, everyone's different in their care, different beliefs. The care that I may think that is good for myself or my culture, quote, might not be the same for someone that has different beliefs. As Tyler was saying, the goal is patient care and be competent of, of their beliefs and with their ethics and how they want to receive their care.
Yes, that's right. So what's the benefit of culture competency? What do you think the gain from getting culture competent? Fatima, would you like to answer that? Anything.
So I think that if you understand where a patient is coming from, like it makes them feel even more comfortable with you.
I think they're also more likely to adhere to the protocol if you work on it together and agree on it together.
Mm-hmm.
Then they're more likely to follow it and
yes,
get well.
So nothing is easy. Everything has challenges and barriers. And what do you think the potential barriers or challenges when you want to be competent?
So many to learn about. It's like what someone may find offensive, like Sauce, I know one time you gave the example, like if someone gave a gift of like soap or something, like that would be extremely offensive, in your culture. Whereas like it is, not for me, and so just learning all those different things when there's so many different people, I can imagine that would be tough in healthcare, and going from patient room to patient room, not knowing what might offend somebody or help somebody.
Yes. Who else would like to add something? So Tyler, you would like
the language.
Yes, that's right. So the potential barrier for we could face when we provide care for patients. There's two main things. The first thing is the perspective and can be ethnocentrism or essentialism. Anyone know what ethnocentrism means?
So ethnocentrism means when you think that your culture is better than the other ones.
The second one, as Tyler said, is the communication, the language. I would like to introduce this model for you. Anyone see this model before or heard about it? Kambina-Bakut model of culture competency. Anyone?
I've never heard about it. I mean, I've never seen it before.
No, me neither.
So this model can help you, like it's to be culturally competent. It's like a guide or a tool. So to meet the challenges we talked about earlier, or we talk about these barriers that we could face when we provide care for a patient, we have this tool. So it's like guidance to help us to know where we're going. It's like ongoing process. It's view culture as a competence as an ongoing process. So this Kambina-Bakut model, she developed this model, and it has 5 components integrated of awareness, skill, knowledge, encounter, and the last one is desire. And it represented, as you can see, an acronym ASKED, A-S-K-E-D. And that helps you to remember components of this model. Let's talk about each one, but I talk about ask because that makes you remember in the future, like ask, A-S-K-E-D. So this helps you just like to remember in the future, if you would like to use it, of course. So for culture awareness is the process of conducting self-examination of one's own biases toward culture. I would like to give you an example about that. So for example, Sultan, the patient, comes today to the office, and the nurse tell herself or himself that, let me make sure I am prepared to respect this patient's beliefs and preferences. And she's a Muslim. I will not judge her on her appearance or her head hijab, like headscarf. So this is the awareness. You make yourself prepared, like internally, that aware about the patient's culture, your self-culture, and just you don't judge this patient. So next one is culture skill. Culture skill involves the nurse's ability to collect relevant cultural data about their patients. So basically, it's a culture assessment. So when you interview the patient, you ask about cultural questions, about religion, about food, about stuff like how you interact, background, how they come to this country. So your ability to interview the patient, to collect data about the patient. So the next one is knowledge. Cultural knowledge involves seeking and obtaining an information base on different culture and ethnic groups. So this cultural knowledge, you can get it from like today, workshop, training, you can journal articles, textbooks, seminars, but also, for example, you have patients come in at 10 o'clock this morning when you check the schedule, and like she's Swahili patient or Tigranian patient. And this is the first time you encounter this patient. We all have access to internet, to computers, to any like websites. You can Google it, even just get few information about the patient. That's gonna be helpful to start. And then you can, after that, through your skills, you can get more information. Anyone has questions?
I have a question.
Yes. Hope I have the answer.
So I agree with this for sure. How do you, when you're looking up cultural knowledge, how do you know, what are some ways you can know you can apply it to the group as a whole? Or say like, I wonder, I maybe shouldn't do this because I'm not sure how they are individually.
Okay, my opinion, which is from my experience, I'm right, but don't generalize. Get the big picture first. But each patient takes individually, because sometimes you make assumptions about something. For example, when I used to work as interpreter, like we used to say to the providers, don't shake hands for women, because Arabic women usually, they don't shake hands. But this is not, you can't generalize. This is something you need to ask. Because like Muslim women, they don't shake hands, which is not all of the Muslim women, but there's like, again, Christian Arabic women, there is Jewish Arabic women. And so the culture encounter. So culture encounter is defined as the process that encourages a nurse to directly engage in cross-cultural interactions with patients from culturally diverse backgrounds. Okay, so the last one and the biggest one is desire, which is refers to the motivation to become culturally aware. and to see culture encounters. So this is like willingness to learn, passion, commitment to open and be flexible to other culture. And I will show you a picture in a little bit about this one. It's interesting. So here's the picture. Can you see it?
Mhm.
The cultural desire, they envisioned it's the base of the volcano. If you don't have the desire, you will not do anything else. You will not make effort to develop your knowledge or skills or encounters or awareness with the patient. So this is the base.
That from personal experience, like cultural interactions, whether it be in the medical field or outside of it, can be intimidating. It can be uncomfortable at times, just if there's a language barrier, if there's just those barriers that come up. But I think the more that you do it, the better you'll get at it, but also like the more joy you find from it, and that will increase your desire to learn more about those. So I think it is like a tough step sometimes at first to get out there and ask questions. You don't want to be offensive, of course, but you also just need to be like, I'm interested in learning this. Like, I don't know everything. Help me.
So if no one has questions, thumbs up. Okay, so now it's time for the test. So we have this case study. Anyone would like to read it for us? Okay, thank you, Melody. So this case study, and based on the model that we just learned, we have some questions. So the question is, how does this patient make you feel?
Concerned. I'm worried about my patient, about their health, of, the refusing treatment.
Second question, what kinds of issues are involved in her care?
We don't know if she speaks English or not.
Mm-hmm. So what else would you like to know about KI?
I would like to know what she understands about diabetes, like what's happening in her body. Like if she feels okay, she might be like, there's nothing wrong. Why would I need this medicine? Why would I need this insulin?
In general, about this case study, anyone would like to add something? Anyone has any thoughts, any comments? So we wrap up today with some main points. The summary of our training today is cultural competence development is a journey. There is no fixed goal. There is no point to say, oh, I'm done, I'm finished, I'm culturally competent. It's a process of self-reflection. We change, and the situation change, our job change. So we need to adjust and adapt based on our new jobs, new demographic. Any question? What do you think about this model? Do you think it's helpful? Any thoughts? Please share.
I appreciate the reminder that it's a desire to have to learn. So while I don't work in healthcare, Tessa, and you may have missed that, I don't work in healthcare, but I certainly work with a lot of people in the community, and kind of nice reminder that you kind of have that desire. You have to have the desire to want to learn. And even
I really like it, and I really appreciate you giving us tips on how to desire to be cultural competent and how to approach our patients and how to help them feel comfortable with the care that they're receiving. And
thank you for participation.